Welcome back to another episode of the Shared Practices podcast. Today, we're going to be talking about a really interesting topic all about building a practice, not a job. And, this is something that gets thrown around a lot where people talk about, a dentist isn't an entrepreneur, or until you have an associate, you haven't really built a business. And I think that there's layers of that are true, but I want to maybe take a step back and really focus on the type of sentiment and conversation that's going to be productive for you wherever you are, right? Because if you're listening to this episode and you're a solo dentist and somebody says, if you are the only dentist in your practice, you have a job, not a business, that's not very helpful, especially if you don't intend on ever getting an associate. What are you really going to do with that advice? And so I want to be constructive, not destructive, and I want to help you wherever you're at. If you're a solo dentist, whether that's a productive solo with 2 hygienists or just a solo with 1 hygienist, how can you make your day-to-day experience in the office more of a business and a little bit less of a job? And so same thing goes to a group practice, right? If you have an associate and you have multiple dentists, whether you're a group or a mega group, how can you build your practice so that it's a business? And I really want to kind of speak on it to each person with where they're at in the journey so that when you are listening to this episode, it's applicable to you, and also it's something that, okay, I know how can I make my day-to-day ownership more like a business and less like a job. I want to maybe just take a step back before we even dive into any specific avatars or talk to a solo or a group practice owner or whatever, wherever you might be. I just want to say, what are the elements of a job versus elements of a business? Well, I think there's a key man risk element of this, where if you are required for performance, it is more like a job and less like a business. And so I think that that's kind of an important fundamental sort of put out there early, which is if I'm driving my practice every day and the performance of that office is highly dependent on me, then it's like a spectrum and a continuum between job and business, or job and maybe team-led performance. I want to talk through, at the various levels, it's all a spectrum is kind of the thing I want to communicate, because I think when people say well, if you're the only dentist there, then you have a job, you don't have a business. That's not helpful. And it's also not true, because you own your own business, right? So you have a business and you're not doing everything. You're not answering the phone every time. You're not seating every patient. You're not doing every cleaning. You're not taking every x-ray, right? So you do have a business underneath you. You do have people who you are employing who are doing things that are making you money. And so I'm going to use the spectrum perspective, where it's on one end of the spectrum, we have a job. And on the other end of the spectrum, you have a business. And how can we spend more time focusing on making our business more like a business and less like a job? I want to start with, a solo dentist. And then but there's layers to this, and it looks different. So let's start with a solo dentist, right? And let's start with what I would call revenue driving behaviors. And so if you're a solo dentist, then your revenue driving behaviors are getting patients in the door and then converting treatment from those patients. Those are sort of the 2 core things that are really going to drive your performance. If you are the type of person who is maybe more on the job end of the spectrum, then maybe that means that are you micromanaging your front office? Are you, constantly reminding people that they need to do things that are going to lead to patient flow, right? That's a good example of having it more like a job, where it requires your sort of nagging, pushing, micromanaging of team members to get them to do what they're supposed to do. So I think a really good example of this is the phones, right? There's certain people, when the phones ring, if it rings 3 or 4 times, they're walking up to the front office and they're saying what are you doing? Why did you not answer it? And so then if there's ever a day where maybe they don't see, whenever we're talking about anything key man related, you really want to ask yourself the question, does this require me to be on my fullest level of energy and intensity every single day for us to perform? That is very job-like, right? Where it's every day when you go to the office, you have to have that energy, that intensity, that drive to perform, or else the business will suffer. And that's kind of the telltale sign. And it's definitely going to come up when we talk about case acceptance. But a really simple stat is the missed call rate, for example. Do you look at the missed call rate? Does your team look at the missed call rate? Do we know to hold our team accountable to the missed call rate, right? That's transitioning this. So like the job way of doing this is the phone rings 3 or 4 times. I go up to the front office. I have a conversation with them so that when the phone rings, the staff is thinking, I better get to it quickly or else owner doc is going to come up and have a conversation with me, right? That's making it a lot like a job. Versus if we're like, you know what? Your missed call rate is one of your KPIs that lets us know that you're doing a good job. Then when the phone rings, there's a sense of ownership within that person who's answering the phone where they're saying, you know what? I'm going to pick up the phone. That's my job. And if I don't do that, my missed call rate will suffer, which is a direct reflection on my performance. And so you're going to see that every time we talk about how to make something more job-like into more business-like, it's a migration from owner-driven results to team-driven results. And how do you get team-driven results is through KPIs and ownership from team members. Let's use like maybe a different example, which is the overdue recare list, right? So overdue recare is going to be one of the most important things that you're going to need to do as a means to what we call reactive retention. So proactive retention is when your hygienists book the patient's next visit while they're in the office. That's the most effective and best way to retain your patients. But that's not going to happen all the time. So let's say you're doing that 80% of the time, which I wouldn't be happy with. We tend to, at Shared Practices, want you to be doing around 90% or more of your patients who come in for hygiene to be reappointing them. That would mean that 10% of the patients that you see on any given day or any given month are going to end up on your overdue recare list. Once that happens, then we move into what's called reactive retention, where we are going to have a front office team member, especially usually a patient care coordinator. They are going to be calling a said number of people on a said frequency to get them back in. Typically, you're going to want to have about 20 calls per day. And one thing that we love about Practice by Numbers is that they make this an exceptionally easy thing to track, where the team members log their calls in Practice by Numbers, and then that actually allows you to go look at their performance. How many calls are they making? How many are answered? How many went to voicemail? How many scheduled? And that's a business-like function, right? So let's just say I have a front office team member who is calling overdue recare, who is, logging it into Practice by Numbers. Then I am more like a business owner because I can just log into a dashboard, I can see what's going on, and then I don't have to go up there. Versus a job-like way of handling this is I would go up to the front office. Did you make your calls today? Who did you call? What happened? Right? It's very owner dependent. And then maybe one day you're tired. Maybe one day you're not at your best. And then are you going to have the energy to go up there and have that conversation with them? Probably not. Then performance will suffer because you have a job, not a business. That's an example of overdue recare. But I would say the biggest example of this, and this applies to the group, this applies to the mega group, this applies to the solo, is your case acceptance. So your case acceptance is going to be extremely important because that's going to be the thing. So like think of the day-to-day life that you have right now. You are getting called out to do exams in the middle of all different types of procedures. Maybe sometimes you're doing a class 2. You have maybe you have everything ready to restore, and then you get called out to do an exam. You're going to leave that restorative room, go into the hygiene room, and in the back of your mind, it's going to be very hard for you to if let's just say you're going through the patient's mouth and it's like, man, this patient has maybe 3 cracked amalgams, asymptomatic, they have wear on their back teeth, and they have lower crowding. Right? It's like, okay, I could potentially bring up either 3 different crowns or fillings, depending on the amalgams, or I would maybe need to discuss a night guard, or I would want to discuss Invisalign with the patient. It's like, but I've got a patient next door who I've got to, fill. I got to prep these teeth. I have it isolated. Like I need to go back and fill. And so that's going to happen throughout the day where you're going to be coming in to do hygiene exams and you're going to be in the middle of something and you're not going to be fully present or available. Right? So if your case acceptance is very you dependent, well, that's more on the job end of the spectrum. And what that's going to do is it's going to make it so that you're not going to fill up your schedule on the doctor side unless you're on your A game every time, which is just unrealistic. It's unrealistic to think that every single time you walk into that exam and you see that patient with the 3 cracked amalgams, the wear on their posterior molars and lower anterior crowding, that you're going to always have the time to sit them up, to educate them on why do the asymptomatic teeth need treatment, why should they wear a night guard, and maybe why should they address their lower anterior crowding with some Invisalign or some clear aligner therapy, right? That's going to be kind of a tough expectation. Versus, let's just say that you have a hygienist who goes through the educative exam with the process and they come and get you for the exam and you guys do a little bit of a debrief. And they say, all right, Mary Sue's ready for the exam. I talked to her about her lower anterior crowding. She's not interested in Invisalign. She is interested, however, in addressing the, cracked amalgams that she has. She understands. I explained to her that even though they're asymptomatic, they still require treatment. And oftentimes when they are symptomatic, they're going to need more treatment. And she's also interested in getting a night guard when she's done with that so that she can, prevent this from happening moving forward. Great. Now, you, on the way from your restorative operatory to the hygiene operatory, you've been briefed on what this patient needs and how are you going to deliver that exam efficiently to get case acceptance. And that wasn't because of you. That was because your well-trained hygienist understood your clinical protocols, was able to co-diagnose and effectively position that patient so that they are aware of and understanding their needs, so that by the time you walk in to do the exam, they're ready to go. And then you are going to be brief because the patient already knows. You're not going to have to sit there looking through the mouth and say, man, do I have time to explain this to the patient? Because that's what happens a lot of times, is you're looking through their mouth and you're like, man, this isn't emergent, but it's going to require some explanation. Do I have the time? And if you have a team member and you're running your practice more like a business, then you're going to be leveraging other people's times to get results. So then you walk in, you spend less of your time, you fill up your schedule, and you're running your practice, even as a solo dentist, much more like a business. And so the theme here is, like, if you wanted to think of a simple way of thinking about it, it's like, I want to build my practice so that it's there for the bad days. Right? On the day where life's happening, I didn't wake up on the right side of the bed. I don't have it today. I just need to get through the day. I just need to do my job. Your practice will still perform. The phone's still going to be answered. Overdue recare will still be called. Case acceptance will still occur. That's how you know you've built more of a business. Like, the next time someone says, if you're a solo dentist and you don't have a business, be like, well, you know what? My phone gets answered. My team has a sense of ownership over their roles. All of the things that are required for us to perform happen without me, and I leverage my time through other people to have my business perform. That's what a business is. There isn't really a business out there that requires none of the owner's time. There's only businesses out there that leverage owners' times more or less than others. And so when you're thinking about building a business within your practice, what you're really doing is just saying, I want to build this business so that it needs less of me to perform and more of other people instead of me. And so you could see here in the solo dentist, we went through a few different examples, and I'll just do one more, which is proactive retention, hygiene reappointment, super important. And so if you are the type of dentist who is interested in growing your hygiene recare base, the most effective way of doing that is retaining all the patients who are in your hygiene department at the moment. And so that's through the form of booking their next visit. And so we like to see about 90% of patients in hygiene book their next visit. A business way of doing that versus the job way of doing that is, the worst case scenario is for you yourself to be booking all of these patients' visits during the exam. Like, that would be the most job-like way, the most key man risk way of doing it. Maybe more commonly is staying on top of your hygienist. Say, like, did they make their next visit? If so, why not? Like, essentially pestering them after their visits with patients to make sure that they made the next visit. That's like the job-like way. That's probably much more common for dentists. And then, the business-like way of doing that is saying, all right, hygienist, we have some incentive plan based on your reappointment rate. It needs to be a minimum of 85% for you to qualify. And, this is how you track it. It's on practice by numbers. And that's how you do this. And then all of a sudden, the hygienist is like, okay, they have a sense of ownership. It's like, well, I want my compensation. So I'm going to reappoint. And then I'm going to really drive that proactive retention, all without the owner's involvement or without the owner following up with them on a routine basis, because I have a metric that I'm held accountable to, and there's a result if I don't hit that metric. Again, the more you go towards the business end of the spectrum, the more you're going to rely on a sense of ownership from the team members, incentives, KPIs, and all of the things that you're going to need to put into place to really drive performance in your team. You can see there, I just went through several examples, but it can apply to any type of activity in your practice. We went through the example of the missed call rate. We went through the example of your overdue recare reactivation, which is reactive retention. We also went through the example of case acceptance and getting diagnosis, case acceptance, all the way through hygiene. And also we went through the example of your proactive retention or your reappointment rate in hygiene, right? All of those different examples, we went through the job-like way of doing things and the business-like way of doing things. And we talked about it all within the regard of a single dentist who doesn't have an associate. So you can see that this whole idea that, oh, well, you're a solo dentist, like you can't possibly have your own business. That's just not true. You can run your business more like a business, or you could run your business more like a self-employed job. Right? It's just about how much of your time do you leverage through other people and how much sense of ownership do you have with the various people on your teams and their various roles. Moving forward, let's talk about the group practice, right? So what really changes with the group, right? The group's still going to need to have the missed call rate. They're still going to need to have the overdue recare reactivation. They're still going to need to get case acceptance in a scalable way. And they're also going to need to proactively retain their patients, right? So everything that we said regarding the solo practice is going to apply to the group owner with one associate, or even the mega group owner with 2 or 3 associates. And so what really changes is talking about the office manager and the associate. So let's start with the associate, because that's kind of the big change with a group, right? Once you go to a group practice, now you're building a business underneath yourself where you are not needed to produce restorative dentistry, right? That's the major shift, right? When you are a solo dentist, you're not needed for the hygiene side of things, right? You can have hygienists who can produce preventative care and diagnostics. You can have your assistants do your diagnostics and, take x-rays and whatnot. But you are needed for exams and you're also needed for restorative treatment. So then when you go to the associate, now you're delegating that as well. So you're even leveraging your time even more and you have other dentists doing dentistry. And so, the thing that's going to happen though is the job-like way of doing that is like you're going to have to diagnose and tee up patients for the associate's treatment to do, right? So then it's like you're going to have someone to do the dentistry, but you're not going to have a great way of filling the associate's schedule. So you might need to chip in doing exams, teeing up treatment for the associate so that they have work to do. That's a job-like way of handling that. The other thing that could potentially happen is you could have an associate who is not able to generate treatment on their own, and then you're going to have maybe an unproductive associate, or you're going to have an associate who's unable to get busy, and now you're thinking, okay, well, I need to go get a hustler, or I need to go get somebody who has equity, or I need to go get a partner, somebody who's going to take a higher degree of ownership. And it's like, that's one way of handling things. And that's much more of on the job end of the spectrum. On the business end of the spectrum, it's going to look very similar to the solo. Using your hygiene team and your dental assistants, your auxiliary team, and having them chip in to the case acceptance process is going to really be key. And so whenever you're attracting associate, the best sort of job pitch or sales pitch that you could give to get them to want the position is talking about how they're going to plug into a system that's going to make them productive and effective. Having something like, at our practice, we have a very diligent process where we've calibrated our hygienists on our philosophy of treatment. And when you walk into an exam in our practice, the patient is already aware of what you are likely to recommend, and they also are ready for it so that you can plug into our system, and with our patient flow and the amount of needs that we get and the way that we schedule and the way that we run our team, you're going to get busy and you're going to make good money, right? That's the type of business approach that you can have when you're attracting associates so that you are not reliant. They're not reliant on you to be productive. They're reliant on the business you've built to be productive. It's very similar, right? It's having that co-diagnosis process in place with your hygienists and having everything sort of run business-like, where it's repeatable, it's systematic, and it gets results. And then the associate is a cog in the wheel, right? So you want an associate to have the experience of, man, I came to this practice and it just kind of runs without me. It's just I just kind of go in, I do the dentistry, I walk into the exams, the patients already know what they need. I just kind of confirm what the hygienist is finding and finalize my own diagnosis. And then when I come in, the way that we schedule, the way that we get case acceptance, the amount of patients we're seeing, it all is kind of happening around them. That's going to be the best results when you have an associate. And, I think the other thing I'll say is this is, going to be very similar to the solo, right? So it's building blocks, right? So the solo who wants to make their practice more business-like is great preparation for an associate, because a lot of times what we do very commonly at shared practices, we call the solo to group transition, which is we take a dentist who has no associate and we position their practice to be ready to receive an associate. And there's multiple parts of this, right? There's one part of this where we need to ramp up the patient flow so that we have enough patients to bring on an associate and have them stay busy alongside the owner doctor, remaining productive. And then on the other side, we're going to have that hygiene team calibrated and ready to go so that the associate is going to be productive and effective without needing their skill set to really drive the show. It's more the systems that we put in place in the practice and the business that we've built underneath them and around them that's going to really allow them to flourish in our system. And so, there's kind of the football term of the system quarterback, right? Where, you have a head coach who has like their whole philosophy and their way of running their offense and everything. And they just need the quarterback to kind of come in and kind of go through the motions and kind of execute the system. That's really in best practice is how you build a business-like approach to having an associate, is building everything around them so that they just need to come in and be a regular dentist. And there's this great mindset that a lot of entrepreneurial dentists have where they say I just want to act like an associate in my own practice. Like, I don't want to do anything to get results that's above and beyond, because that's not going to be replicatable. And so there's some owner dentists who I've talked to in our mastermind who are especially intentional about making sure that they are just like an associate in their practice. They are not trying to be Mr. Charismatic or, doing anything that is like really intentional to drive case acceptance. They're really just showing up and doing what they think an associate would do and trying to build the team around them to get the results they're looking for so that they can put an associate in their place and then have it really kind of sustain the performance that they've been receiving. And that's like the most business-like way of handling things. I think the last thing I'll say on the group practice side is the office manager. And the office manager is going to be like, there is such a large spectrum of what an office manager does in a dental practice, right? So this is going to be an essential piece of having an associate, because once you get an associate, the administrative burden goes up, right? You're going to have more team members, which means you're going to have more cultural challenges like, drama between team members and those types of things, HR. And then you're also going to have, more complicated scheduling, people taking days off, needing other people to cover. You're also going to have more payroll, right? So you're going to, maybe have payroll to calculate. And then also the associate is going to require some administrative management. So for example, they might have feedback for certain team members. Maybe they're unhappy with something that happened with an assistant, or maybe they don't like the way the front office scheduled for them. Or even on a day-to-day basis, there needs to be some communication with the associate around their production. You don't want it to come till the end of the month and you and the associate are arguing over what codes are set to complete under which providers, right? So typically when you have an associate, you want to have like a day sheet activity where you print out the production from the prior day and the associate reviews the codes and signs off on the fact that, yes, this is what I did yesterday. And then they were able to see their production on a day-to-day basis, right? All of this is a lot of administrative work. And you as the owner dentist, right, if you are doing all of these things, which, kind of going back, we've had many guests on Practice Underwater over the years who are, multi-doc owners who are doing the running payroll, they're managing the schedule, they're handling the HR, they're talking to the associate, like they're doing all of these things. Well, they have a multiple doctor office job, right? So it's like that whole idea that if I just get an associate, I have a business underneath me, that's not really true. It's how you run your business that makes it more like a business and less like a job. And so having an office manager in place, there's some office managers who they have the title, but they're really either serving in the insurance coordinator function or in the treatment coordinator function, but they're called an office manager, right? So if your office manager is spending 80+% of their time either, talking to patients about treatment and getting case acceptance, or they're just, handling the accounts receivable and the insurance claims, then they're not really an office manager. They're an insurance coordinator who's titled office manager, or they're a treatment coordinator who's titled office manager. Somebody who is a true office manager, they're doing all of the things I described. They're managing the team's performance. For example, if somebody comes in late who's having that conversation. If it's the owner, then the owner's job is managing the team. If it's the office manager having the conversation about tardiness, then the office manager is managing the practice and the owner is much more like a CEO leading the company, but not doing the day-to-day management. And so I think that that's where you're going to have a lot of this type of difference between what's a job, what's a business, is the office manager position at the group level. Like the office manager, really all HR related concerns. So any team members that are unhappy with other team members, any team members that need time off, any hiring or firing, any performance management, any onboarding, all of these different things are going to be essential for an office manager to handle. To run your practice more like a business, a simple way of doing it is, like obviously there's the obvious ones, like printing the day sheet, discussing it with an associate, running payroll, talking to team members about being tardy, hiring, firing, managing performance, onboarding new team members. Those are going to be the functions that an office manager is going to be able to slide into quite naturally, right? But then, if I were you and you're maybe owning a group practice or you have an office manager and you want them to be more like, you want to run your practice more like a business, then I would just make a list of what you're doing, right? Anytime you're doing any administrative work, write it down and ask yourself the question critically: can someone else do this, or do I have to do this? It's like now in shared practice, we've been doing this we're on our 10th full year of recording the podcast, and we've helped, thousands of dentists over the years, and we've talked to a lot of dentists, and we understand, kind of what's going on in their world. And the thing that we've learned is that we've inspired a lot of people to grow to group practices. There's a lot of people who have listened to our philosophy and said, okay, like it's a pretty straightforward philosophy, hygiene-led growth, according to the shared practices philosophy. You add more providers, you fill their schedule with patients, you retain those patients, and you grow your practice methodically, right? Like we've done this many times now. Hundreds of practices have taken this advice. What's happened is we've created a lot of group practices. And then there's really like two different realities for the people who own a group. There's one group people who are maybe working 2 days a week, 3 days a week. And in the other time, they're really like enjoying their day-to-day life outside of the office. Like the practice is done growing, it's more in steady state, and, they have their time back. And they have the benefits of the business they've built. They have team leads at each position. They have an office manager who's running the team. They have associates doing a lot of the dentistry. They have a lot of coverage when they're not in the office, right? They've built an impressive operation underneath them. And then on the other side, you have these dentists who are like, man, I've built this group and all I've done is given myself more work. And those dentists aren't nearly as happy in the group. And then they start asking the question, should I go back to being a solo when it was much simpler? And so I would say that if you're a group practice owner and you find yourself thinking about, man, maybe I should go back to a solo, which is funny because the solo docs, they always, not always, but there's a good portion of solo docs who are looking at group practice owners and are a little bit envious of them, where they're like, yeah, like I really want that life, but I'm just not there. And then there's a cohort of group practice owners that are thinking like, man, I really miss when things were simpler. If you fall into that camp, I think that your group practice is a little bit too much of a job and not enough of a business. And so people often think like, maybe I need to simplify. Maybe I need to cut insurance, remove team members, and go back to being a solo. And it's like, actually, it's really much more about embracing the current avatar you're in and doing it properly and really building that group practice. And this applies to a group or a mega group, right? And honestly, if you go from a group to a mega group and you haven't put in these fundamentals in place, it's actually going to be significantly worse because the amount of administrative work that grows every time your practice grows, it grows proportionally, right? So if you had, even in some cases, it grows a little bit more, right? So you would say that to have a 2-doctor practice to a 3-doctor practice, you might have like twice the work, even though you're only adding an additional doctor. It's really important to kind of like get the fundamentals of the current level you're in, right? So if you're a solo practice, running your solo practice more like a business then makes that transition from solo to group much smoother, where then the associate comes in and the associate's able to be productive because of the foundation that was built, the business foundation that was built as a solo. When you're a group practice, that business foundation as a group is going to be very helpful. as you go to a mega group, right? You have an office manager, you have productive associates, right? So then you add more associates and more hygienists, and they're plugging into that system of team leads and co-diagnosis and, KPIs for each role and a sense of ownership, right? Like, it's going to make that much easier. I think that, kind of the theme here is, as you're growing your practice, really focus on running it like a business at whatever stage you're at. And really the theme is having a team who has a sense of ownership, who's empowered, who's managed with KPIs, and everything's clearly laid out in their roles. Like, that's really what you should be focusing on as you're growing at each development stage of growth. I think that maybe the last thing I'll mention is that a lot of dentists kind of struggle with the psychological resistance to delegating, right? Where they're going to say, like, man, I just do it better than other team members. Like, I just really think like the way I do it can't be replicated. And it's like, no, absolutely not. The way you do things can never be replicated exactly. But it can, they always say like 80% from someone else that is the realistic win for you. And so putting in repeatable processes in place, and they look different, right? They're not nearly as, maybe if you have your hygienists who are co-diagnosing, they're not going to be able to kind of, have the conversations about complex treatment or opening up the bite or doing any type of comprehensive care. Like, they might not be able to look at a whole mouth and see a comprehensive treatment plan that you could see, right? That's going to be harder to have them replicate. But 80% of the time, you can have them do the things that you can do. And then there's always going to be that area where, you're always going to be able to do a little bit more than them. And so as an owner, it's important to understand that 80% rule, that's more business-like, 80% of the results through other people's time and effort is much better, right? And I think that's the key to begin to build those processes in place and trust your team to delegate, is that you need to have realistic expectations. It's having something that can be done every single time, repeatedly, using other people's time and energy that's not relying on you, that's 80% as good as what you could do if you were doing it your best every time. That's a good and realistic result. I think that there's also this realistic expectation that needs to be made. And then that really allows you to transition, from, like they kind of use the three different hats, right? You're the clinician, you're the manager, and then you're the owner or the CEO. And so it's like you really have that ability to transition from the clinician, to the owner, operator, or manager, to the leader or the CEO. And so the more that you're able to delegate, the more that your team is empowered, the more on the spectrum you can move your time to spending your time in higher level things and having a lot of the other stuff that's required to have the business perform happen through a systematic and repeatable way through your team. That's sort of my best attempt at addressing the kind of the age-old question. Like, you'll go on dental Facebook groups and whatnot, and you see it all the time. People are like, you don't have a job, or you don't have business, you have a job. Like, they all these like hot takes on this subject. And I think that if we're gonna use this vague terminology of, do you have a job or do you have a business? It's like you kind of have a little bit of both all the time. If we're gonna use this vague terminology, let's do it in a way that's empowering, that's helping people wherever they're at. And the way that I would want you to kind of interpret this conversation is, I want you to say, yeah, I want to run my business, because if you own your own practice, you own a business. Like, you collect revenue from patients and insurance companies, you pay expenses, and you take the profit. Like, that's a business. So everyone who owns their own practice has a business. But if that business functions and performs, very dependent on you, it's more like a job and less like a business. If the business relies heavily on other people's time and leverages their time and leverages repeatable processes to rely less on your time to get the results, then it functions more like a business. And so whether you're a solo, a group practice owner, a mega group owner, or whatever you're at in the spectrum, just try to think about it as like, I want to run my business so that it relies more on other people's sense of ownership. We use KPIs to track things. We have repeatable ways of doing things. And I don't need to show up every day at the office on my absolute A game for us to have A+ performance. I just need to show up, and we just need to go through the motions that's repeatable and sustainable, and we're going to do just fine. And I think that that's sort of the ultimate sign of a business, is that you can show up on maybe your worst days, the bad days of the week where you don't have your A game, and you guys can still do well. Your schedule will still get full. Patients will still be informed on what they need. The phone will still be answered. You'll still be able to fill the hygiene schedule through the last minute openings through your overdue recare reactivation process. And you'll still be reappointing patients for hygiene. You'll have an office manager if you have a group practice who's helping you kind of run the show. And you're going to have associates who could maybe produce without you needing to kind of get them productive. They're able to get productive on their own through the team and the systems that you've built, right? And that's sort of the ultimate sign. I hope that this episode was helpful. And I hope that you, wherever you're at in your journey, can just maybe say, okay, I see a few areas after listening to this where my practice is a little bit more like a job and a little bit less like a business. And I'll just take a couple steps in the right direction, put some processes in place, get the practice to be performing more systematic through other people and less through my own time and effort. Thanks for listening to another episode of the Shared Practices podcast. If you enjoyed this episode, please reach out to us at team@sharedpractices.com with any information that you might have that you want us to talk about in the future. Say, you know what, I really want us to talk about this topic or that topic. Submit your feedback to team@sharedpractices.com and we'll feature your topic on the next episode of the Shared Practices podcast. Thanks for listening.
Resonate.